Okay, so this is going to be dawning video for the anesthesia department at Lahey Hospital here. Today is March 25th, 2020. This process could change based on the PPE available, but today Dr. Sheehan will be the clean observer, and I will be the person donning the PPE prior to intubation.
Okay, so the clean observer has a checklist. So the clean observer's job is to confirm compliance, and sole responsibility is to ensure provider safety. Can stop the process at any time to ensure safety of the providers. Okay? So clean observer PPE, the N95 mask, which I have on under my shield mask, and a pair of gloves. So prior to donning, every provider should use the restroom before the start of the procedure. Remove all jewelry, watches, pagers, phones, and leave outside the room.
It's also important to take off your blue jacket if you wear a blue jacket, as it gets quite hot under all the PPE. You should expect to be in there from somewhere from 30 to 45 minutes.
Disinfect hands.
Switch position.
All right, so we're placing, step 4 is to place the head cover. Okay, step 5 will be to put on boot covers. Use a chair if necessary, as you may need a chair for taking on or off.
Having touched the bottom of my shoes, I'm going to go ahead and disinfect my hands again. And this will be on the cart, readily available for us.
All right, so step 6, put on inner gloves with cuffs as far as possible up the arm. Step 7, put on gown using the thumb hooks to minimize exposure, and tie in the back by the clean observer.
So I'm going to put my head through. I'm going to push my hands down. I'd be really careful because you can easily snap this. So I put my arm through, as I already snapped it. If I snap it, and this is real life, I would get a new gown immediately. And as my hands are through, now I would adjust for the thumb loop. And this way it ensures that I don't have the gown rise up on me as I'm intubating the patient. The Ebola patients had this rise up on them, but see, now we have the thumb hooks so the gown doesn't rise up on us. And you can see I tore it by accident, and they're very fragile, but if this was to happen in real life, we would put on another yellow gown.
All right, the gown's tied in the back by the clean observer. Step 8, putting on the N95 mask. And this method may be determined with whether or not this mask is new or is potentially dirty. If you already have the mask on prior to this part, that's okay, but if you don't, this is how we're donning the mask. Okay. Step 9, ortho hood placed with assistance of the clean observer. So we're going to have him lean a little forward, place it on the forehead around to the back.
Good. I would tighten to the minimum necessary standard because you're going to be in there for 45 minutes. You don't want to have it too tight and walk out with a headache. So just to a minimum amount of snugness.
And then we have the striker, hood guard.
It's a two-step process. You can see it's labeled step 1 and step 2.
Step 1. Okay.
And step 2 is with magnets.
Okay.
So it's easier if the person bends down so the first person can place one in position and then place the magnets and then lift over the head. So I have glasses on, and this is great for anybody who has glasses because there's a lot less glare, less fogging. It's worked well so far for everybody who has glasses.
Then step 10, place outer glove up and over the cuff of the gown.
Just for demonstration purposes, I probably would have had these open and out. But during this step, it's important to make sure you go up and over the thumb loops in order to maximize any coverage. And you can see it going up as far as possible. Again, on both arms. For the last step, the clean observer is asked you to do some arm motions consistent with intubation to look for any leaks or any places that are missing. This was done both in the Johns Hopkins video and in China. They really had them look around for anywhere where they felt there was the potential for contamination. The shoe covers are pretty important because if you drop the suction or you had suction, there's something on the floor. And there is also a recommendation afterwards if you want to wipe down your shoe covers. So experience has been that shoe covers are quite important. So that concludes our donning procedure. Hopefully this is of use to everybody. Thanks again. As you can see, I had a wide field of vision. I didn't feel like anything was encumbering me, and even with my glasses, I don't feel there was any reflection. I'm not having much fogging at all. So very at ease.